What if you were you, but had been born inside a body that didn't fit you? This is the struggle that transgender individuals have had to face their entire lives. Thankfully, medical advancements have been made so that transgender individuals can change their bodies into what they feel they should be. These advancements include commonly known cosmetic surgeries like breast implants and facial surgeries, but also include a very effective, not as well-known treatment called hormone replacement therapy, or HRT. The typical fix is a mixture of these things to transform an adult female or male body into the body that the patient actually wants. But what if we could avoid the surgery and simply give the individual the body they wanted in the first place? This is where the argument starts, as the only way that this can be done is by giving the transgender individual HRT for the gender that they identify with before puberty is finished, so that they won't develop physical characteristics that don't fit them. Now, I may not be transgender, but since I realized I was a lesbian at 17, I've been making sure to keep myself informed on LGBT issues. And I've watched this issue's relevance rise more and more, and I feel like this is something that more people should know about. This lies in the fact that we never know when we may have a trans friend come to us for help, or even one day has a child that is trans themselves and needs our guidance. If this were to happen, I would hope that we would all have the knowledge to offer an informed opinion. Today, I hope that you will glean the information that you would need to really develop an informed opinion on this topic, as well as be able to help others do the same. In the next 5 minutes, I'll tell you guys about what HRT is, give you some negatives of HRT to trans individuals, and give you the supporting evidence for it. So let's start by talking about what HRT is. As I've told you, HRT is hormone replacement therapy. But let's talk about how this actually works. For starters, the treatment doesn't actually start with the hormones, but with puberty blockers. According to Dr. Rob Garofalo, the director of the Lurie Children's Hospital's Gender and Sex Development Program, these are medications that block the production of estrogen or testosterone, basically hitting the pause button on puberty until the patient, their parents, and their doctors are sure that transitioning is right for them. Once the child has reached an age where they feel they're ready to transition, and their doctors, parents, and therapists have all approved that they're ready, they begin taking the sex hormones of the gender that they identify with. This means their body now goes through the puberty of their gender and grows to be masculine or feminine to match with the patient. By the time they're an adult, the patient will ideally have the appearance that they envision themselves with from the beginning, rather than wanting to change themselves to look more like how they should be later in life. This may seem like a neat fix for the issue at first glance, until you really think about some of the negatives of a child going through a treatment like this. For instance, this treatment is mostly irreversible, according to Jen Brown, RN and writer for the Seattle Children's Hospital. If a person is transitioning from female to male and takes testosterone, their voice after a year or so will be masculine and won't be able to be changed back. So if the patient wants to fully transition, they have to be fully sure that it's what they want before they start. Along with this, there are many studies that found that a number of children who were uncomfortable with their gender actually grew out of it, while a minority actually went on to fully transition. Although, as clarified by Priyanka Bhogani, a writer for Frontline PBS, these studies weren't done over a large sample of children and were mostly done in other countries, so their reliability is iffy. And another issue with this is that the long-term effects of puberty blockers and hormone use on the human body is still largely unknown. For instance, the blocking of puberty could potentially cause issues with bone strength and increased risk of bone problems later in life, since sex hormones in adolescent development promote bone growth, as mentioned by Dr. Courtney Finlayson, a pediatric endocrinologist. As well as this, long-term hormone use can cause a lack of fertility further down the road, along with a potential increase of certain cancer risks. Even though this treatment can potentially carry many risks, the benefits of it for transgender youths are also undeniable. As mentioned before, the biggest advantage to this treatment is that it allows trans people to bypass the need for numerous surgeries in order to make themselves look how they want to, and instead allows them to simply grow into a body that they can feel at home in. This also means that a lot of the psychological problems teens face could be avoided. since they wouldn't be forced to watch their body change into the exact opposite of what they feel it should be. A 2007 paper showed that out of 55 transgender youths, a fourth of them had attempted suicide at least once. Trans youth also have much higher chances of having clinical depression or drug abuse. Without the dysphoria, these numbers could greatly increase. So to wrap things up, I've told you guys all about HRT and what it is, the reasons we might resist giving it to teenagers, and the reasons that it may actually be the best option for them going through their transition. And now that you've heard both sides of the story, I hope that you feel more informed and that you can truly develop where you stand on it. Whether for or against giving HRT to young individuals, I hope that we can all keep in mind that in the end, this decision should be made specifically with the well-being of the youths in mind. Regardless of our opinions or biases, it's the health of these kids, both physically and mentally, that matters most. Thank you.